But as we've mentioned, we have many other resources there to reach out to if we're not able to get them all. But thank you, everyone. There's so many great questions that are coming in. We look forward to answering some of them. Now, I don't want to take any more time from Terrence and Toni. This is just a remarkable couple that I've come to know over the last several months, who've done some amazing podcasts, as you saw in the previous, who've talked about their myeloma journey. And I don't want to preempt any of it. So I'm happy to bring them onto the virtual stage here. And I really have 3 questions for you today, my friends. And over the next 10 to 12 minutes or so, we're going to think a bit about these questions together. The first, of course, is just really telling your story about the diagnostic process, how the diagnosis was made. And I know that this was wow, it was really a challenging situation. I remember, Terrence, when you told me about what it was like to listen to some of our lectures about how often within the African-American community, there's a delay between symptoms and diagnosis. And you're like, yeah, I know what that's like. So maybe you can tell us a little bit about the story of your diagnosis so we can understand it better.
First of all, thank you for having Toni and I. Back in October of 2014, I was experiencing fatigue, actually. We were moving and ended up in the hospital, actually, with pneumonia. And during that, all the blood work being taken and everything, the doctor at the time approached us and basically said, what do you know about multiple myeloma? I mean, and multiple myeloma, I mean, you mentioned all these other primary cancers that are out there, but we had no idea. And quite frankly, when you asked the question, I was looking at my wife because she kind of took over then. So I'm going to kind of turn it over to her to kind of help it along, okay?
Well, like he said, he was he went to the emergency room and he was diagnosed with pneumonia, and he'd been in the hospital for approximately 9 days now, and he's not getting better. In fact, I don't think he's going to make it out of the hospital. So fortunately, they did more tests and discovered that he did have multiple myeloma. And I was asking the doctor, well, how could this be possible? He just had prostate cancer, and he's been in remission for 2 years. So what is this multiple myeloma? How come it wasn't caught, earlier? Or how come we didn't know when he was going through his treatments or seeing his doctor for his prostate cancer? Anyway, long story short, they then did the bone marrow test and confirmed that he did indeed have the multiple myeloma. And then we were like, well, what's the next step from there? And so he was a candidate for the stem cell transplant. So the plan was select doctor, select hospital, and get the numbers down to the point as low as possible so he can have the stem cell transplant. So in between him being diagnosed and planning the stem cell transplant, we researched hospitals, doctors, interviewed them, got family members involved to help us do the research, because it's a lot of information. It's like, what is this multiple myeloma? It's a big word, never heard of it. So, we educated ourselves, got people involved to help us, especially our daughter. We became more knowledgeable. We asked a lot of questions. Part of our resource was our church, and prayers. And then he did have the stem cell transplant. Let me back up. We selected Memorial Sloan Kettering. We interviewed with Dr. Sergio Geralt, and the moment I met him after speaking with all these other doctors and nurses, it was a match. We didn't have to look anymore.
It was the cowboy boots and the bow tie.
But I do sometimes have to apologize for his bow tie, but Sergio is a wonderful, as the team is there from Kettering. And we're going to talk more about that team notion in a moment, but it is really touching to hear you say interviewing us as physicians. I love that. I love that notion, as opposed to us interviewing you, which is usually kind of the power imbalance, but it sounds like you educated yourselves.
Yes.
You asked the right questions. You
Yes.
interviewed these, and you leaned on your support community. And just a remarkable story. Anyway, I felt like I cut you off there. And so you met Dr. Geralt. You felt that was the match, no pun intended, from a bone marrow perspective.
Yeah.
And you ended up having your transplant there.
Yes. Yes. And
it was pretty interesting because the notion of they call it surgery. I don't know why. I think that term surgery, and I was excited because it's kind of like, all right. But when it actually happened, it was kind of like they put this needle and stuck it and kind of put this fluid back in me that smelled like tomato sauce. But anyway, it was kind of like I mentioned the fact that, you know, when I understood I had this disease, I kind of put my boxing gloves on and said, okay, round one. And the type of person I am, I wish I could have gone through it in a bubble, but I couldn't because I don't like affecting my loved ones that way. And Toni mentioned, you know, I had the stem cell transplant, and she came to, you know, she basically was there 99% of the time, but she brought a poster in, and the poster had signatures from all the kids from the church, and she taped it up at the end of the bed, and it was so touching to me. And the interesting thing about it is now those kids are like, some of them are teenagers now, and I look at them and I say, wow. But this whole notion of support and where you're going to get energy from and who's going to be there, sometimes you just never know.
you know,
That's just a remarkable story. I mean, you're trying to make me cry here in the middle of a program. I mean, come on. But I mean, just to see the signatures of those children, that's absolutely wonderful. I'm so glad the process went well. To clarify for people who are asking, you know, when we do a bone marrow or stem cell transplant, we actually really don't have to do surgery anymore. We hook you up to what kind of looks like a dialysis machine, and it circulates your blood through it, pulls off your stem cells and gives your blood back. And then when we actually give you those stem cells back, they're so smart, they find their way back into the bone marrow. We don't have to inject them anywhere. We just give them into your blood. And so the concept of a transplant is we take what are called your stem cells out of you, which are basically like seeds that can grow new bone marrow. We give you a big dose of chemotherapy to get rid of what's left of the myeloma, and then we give you those stem cells back. So my second question to the two of you is, you have found this really beautiful balance, as I understand it, between still getting your care centered in Connecticut with a community oncologist. I know this has come up a few times, and there was a question about the difference between a community oncologist who kind of takes care of all cancers and having that connection to Dr. Geralt and the connection to Memorial Sloan Kettering in this kind of shared care approach. I know a lot of times we do workshops like this and people say, well, you know, doc, I don't live that close to a major academic center or to a myeloma specialist. How do I get the best of both worlds? And we're not saying that absolutely everybody needs to be seeing a myeloma specialist all the time, but if they can have a connection to one, sometimes that connection is just virtual, doctor to doctor, but you've been able to be in a situation where your connection is real, where you both get cared for by your community oncologist and by the great folks at MSK. Can you talk to us a little bit about that?
Yes, since the stem cell transplant was done at the Memorial Sloan Kettering, we wanted to make sure that we had a really good understanding of the disease, the process, what we can do, how we can help, and what their part of it is. And I have to just say, my wife and our oldest daughter, they were outstanding through this process, and the note-taking, the questions, etc. So once Dr. Geralt and we felt comfortable that, all right, now we can kind of, since we live in Stamford, Connecticut, have the maintenance take place there at Stamford Hospital. And they were great. They are great, but I made sure, and we made sure they understood, if something should happen, i.e. the M spike or anything out of the ordinary, we are headed right back down to Memorial Sloan Kettering. So what happens is I go there on a weekly basis. I get my treatment. They draw blood. When they look for the M spike, I go into the portal, because both hospitals have a portal, and that's how we communicate if it's not via phone. I take the information, I copy and paste it to a Word document, and either I'm putting into Memorial Sloan Kettering's portal or vice versa, putting their information from Memorial Sloan Kettering into Stanford Hospital portal. So they're all aware throughout the entire process what's going on.
I think that's really beautiful the way you share that, because it really is a partnership, right? I think sometimes, I've had patients say to me, well, am I being unfaithful to my doctor to go get an opinion with a specialist? Or, more often than not, we love to work together. And I do this all the time in my practice as a specialist. And so I'm really thankful to hear that you've developed that. Our time is going so quickly, and I want to come to our last question, which you've kind of answered already, but I just want to hear the two of you love on this question, which is tell us about this team approach that you've taken, the two of you together. I mean, when you said Terrence and Toni was there 99% of the time, I mean, from what I know of Toni, that is totally true. I mean, she loves you. She loves you good, and she cares for you. And what it was like to have that kind of support. And you mentioned already the church that you've leaned on. Help us understand that aspect to it, because I think it's so important for all of us to hear that this is a journey that so often, thankfully, does not have to be taken alone. There are some patients I know I've taken through this process that have very little support, and we seek and encourage them to find greater support. But tell us about your journey that way.
Oh, yes, definitely. So, like we said, we took advantage and tried to find as much support as possible. And one thing I do want to mention with our church is that they did do this 100-day Tizay for him. It was amazing. It was so beautiful and just amazing. Another thing in terms of our doing research and trying to get as much information as possible, it led me to Robin and Michael, to their support group in Preston, Connecticut. Now we are in Stamford, and they're about an hour and a half away, just drive for us. So just
that's how good they are.
Yes, that is how amazing, because there is one that's closer, but Robin and Michael's support group is amazing. It's amazing to us because it truly is support, not just emotionally, but educationally as well. In terms of the people that they have presenting to us, like Robin alluded to, the nurse. We had Dr. Jury on at one time. And so we're always educated in terms of, what drugs are coming down the pike. We talk about our experiences, where we are, or the patient is. I'm constantly trying to tell the patients to remember to tell the truth, tell the doctors the truth, my husband included, and just exactly what Nurse Ann said, right? Amy, tell the doctors how you're feeling, because if they don't know what's going on, they can't help you. But Robin and Michael are very knowledgeable. I know there have been times in his myeloma journey, meds had to be switched, and we weren't familiar with them. So that's when Michael and Robin came in handy, because we discussed with them, and they gave us more information, a lot more information than what we're reading. So it's great to have the support group there, and we love them to death, and we don't know what we'd do without them.
Yeah. I would like to say that Toni is a very detailed person. And I have to say this. I remember a time when I was in the hospital, after the stem cell transplant, and my daughter and Toni were there, and they were talking to the doctor, and they were asking these pointed questions. I put the sheet over my head because I felt bad for the doctor. So that's how good they are. I mean, it's a positive, but I was like, whoa. But yeah, I just wanted to share that, because that's the whole point. The note taking, the detail, because I always have to ask Toni, what meds am I on? Really?
Well, not for anything, but when he was first diagnosed and then being in the hospital, for the pneumonia that he had, then he had the multiple myeloma. He was not himself. Yeah. He was just, out of it. So he relied on us for everything. And we didn't go into details with him about what the stem cell involved, what the recovery involved. We just wanted him to, focus on dealing with the cancer and getting better and focusing on the end result. But we didn't want to, give him all the details about what was about to happen or what he had to go through. And, it was difficult for all of us, but with, all the support that we had, it was, having faith and hope.
I was a bystander.
What an incredible story. You are sort of embodying empowerment, right? Today is all about empowering people both individuals, as I said, the communities to change the course of myeloma, but just in your own area, to have the power, as Amy explained in her talk, to ask those questions, to understand.
Yeah, I think that some patients feel like asking questions or, it's like bothering the doctor, or maybe not wanting to show that you don't understand, but you have to ask the questions because the medical language is a completely different language than if you're in finance or whatever field you're in, but you have to ask the question, you have to understand, and you have to let make the doctors make you understand.
I completely agree. And I think that's what we're really, and I've seen a revolution in medicine, which I've been very happy for. Even part of my work and research over the years has been on patient communication and how important that is. And that we go away from this notion of, the doctor basically just tells you what to do. You don't get to ask any questions. You just have to do it. And so this has been really a revolution. As I mentioned, Susie Dury led in this direction long before others thought about it. And now it's really become the norm. Well, thank you so much, Terrence and Toni. Just love the two of you. I could talk to you all day long. I'm sure the people listening are like, come on, don't end the interview now. But time is going real quickly, and we want to spend the last few minutes doing